Hello, my name is Patrick Kurdila. I'm a nursing student at Old Dominion University, and I'm going to do my presentation of my public image of what a nurse is on the image of a nurse being resilient and competent. So I wanted to start my presentation with the obstacles that every RN has to overcome, and I think this image should be presented to the public. So every nurse has to complete a 2 to 4 year program in which many things are sacrificed. Every nurse has to give up time with their family, has to not go to sporting events or miss birthday parties, and a host of other things to go to nursing school. I think this should be conveyed to the public, and I think that this should be represented in the image that we show to the public. Also, as nurses, we have to work 12-hour shifts where we're constantly standing, pulling, pushing, and we have to keep ourselves in good physical shape, or we'll pull our backs out through lifting and pushing patients. Also, we have to make rapid, critical decisions while the family or the doctor is standing right next to us. And in this stressful environment, we have to be calm and consistent with our training and our decision making. So we also serve as a counter to disease, death, and deterioration. So this should be conveyed in the public image of what a nurse constitutes. So the main image that we should all combat is that we are the doctor's appendage. So we are just a tool the doctors use to carry out their treatment plan. The public image can be one of we are the assistant to the doctor, we are less knowledgeable, we are not a distinct scientific discipline, we are effeminate and subordinate, and we are not intelligent enough to get into medical school. And from my experience and the people I've met, this does not ring true. Some of the nurses I've met are extremely intelligent people that have chosen the field because they enjoy nursing and they prefer the nursing process to the processes of disease management of being a doctor. So in the bottom left corner of the screen, I attached a photo that detailed a controversy regarding the public image of being a nurse. A few years back, Miss Colorado went on stage during a beauty pageant, and she described her being a nurse and what that entailed and how she was proud of it. Now, the hosts of The View went on to criticize her and say, why is she wearing a doctor's stethoscope? Can they just bring the doctor in? What do you even really do? And this enraged a lot of nurses, but it kind of reinforced the public view of what a nurse is. And this is not true, and we need to have control over our image in the public sphere and educate the public on what we do in terms of making decisions about medications management. We, monitor the side effects of medications. We tell the doctor. We use the nursing process. We conduct scientific research and adapt that into standards of practice. There is just a plethora of things that nurses do, and the public needs to know this. So now I want to focus on nursing actions which erode the public trust. So these negative behaviors include we have a low percentage of nurses that are members of the ANA, the American Nurses Association. So this needs to be corrected because without membership in the ANA, we can't influence public policy and we can't influence how the public views nursing. Doctors have an incredible political representation in the AMA, and the ANA is there for us, but a lot of us aren't utilizing it. If we wear printed scrubs, that conveys that we're not professional. That we don't take our job seriously, even though it can be fun to dress up. Dog-colored scrubs or polka-dotted scrubs don't convey the image that we are professionals. So we could adopt a victim mentality and adhering to the principle that the doctor is the decision maker. So that reinforces the viewpoints I said on the previous slide that the doctor is, omnipotent. So if we wear too many decorations on our scrubs, such as pins, and we look like we work at Denny's as opposed to being professionals. If our tattoos are uncovered and like the image of the nurse to the left here. If we wear excessive jewelry, put on too much perfume, or have generally bad hygiene, this all impacts the public view of nursing. So now I want to focus on how we can utilize the research to convey an image of professionalism to the public. So the research demonstrated that patients did not care about the color scrub that nurses wore, but they did care that nurses didn't wear printed scrubs. Nurses who wore printed scrubs were perceived as less professional. Also, nurses that practiced good hygiene were considered more professional, even if they didn't have good practice skills. So if we combine good practice with good hygiene, the nursing profession could really improve the public image. So patients prefer that nurses wore their RN badge prominently so they could be easily identified as well. So now I want to focus on the research that shows how we can improve our nonverbals to convey an air of professionalism. So we should use a normal tone of voice when speaking with patients. We shouldn't look at our cell phone when dealing with patients. That's pretty common sense. We should listen carefully and respond calmly even if we disagree. So this point I want to harp on because in the hospital, patients and their families can be very emotional, and we need to serve as a calm force. They can attack, they can become belligerent, they can become aggressive, and as nurses, it is our job to, portray an even keel, even though we may feel internally really stressed out. So if we start becoming anxious and react to our negative emotion, the patients it'll just exacerbate the situation. So we should stand up straight with relaxed body posture, avoid humor that may offend, answer the telephone in a professional manner, smile, speak clearly, and maintain eye contact. So now I want to focus on how we can protect the image of a nurse 24/7. So our responsibility to the profession doesn't end when we clock out after a long shift. We have to realize that people will look at our title and respect what we have to say. The Gallup poll showed that nursing is the most trusted profession. And if we start demeaning the profession, if we don't tout scientific research, we demean the overall profession and the public image of who we are. So we need to be proud of our license, our training, and convey this to the public in a professional manner and not get pulled into emotional arguments over the state of healthcare with our family members or people on Facebook. I now want to focus on the pitfalls of social media and how in an ever-changing world and global connection with Facebook and Twitter and Instagram and these social media platforms, it's important as nurses that we protect our image on these platforms. The political environment is incredibly divisive. People have strong opinions that may not be supported by research. And as nurses, we need to realize that we do carry weight. We are part of the medical establishment, and we need to convey a professional image in our dealings with people online. So if we're going to engage online, we need to realize that our positions could be misconstrued as hospital policy, and then this could erode the public trust. So, sticking to the scientific research and not, getting pulled into opinions when engaging with family members or people online about a divisive topic like whether to get the flu vaccine or the debate over our healthcare system. We need to stick to the scientific data as opposed to our personal feelings because this erodes public trust if we engage in a back and forth with people. I want to conclude this presentation with my own conceptualization of what it means to be a nurse. I have encountered numerous nurses within the field, and I've seen they exhibit these characteristics. They are resilient, they're tough, they're competent, they're intelligent, they're independent, they're hardworking, they're caring, and they're problem solvers. They confront disease and death daily, and they do it with incredible inner strength. And I think we should convey this image to the public so they don't view it as some discipline that is an appendage to a doctor or subservient. Thank you for listening to the presentation. Here are my references, and thank you.